Can AI replace doctors? Artificial intelligence, AI, has the potential to assist doctors in many ways, but it is unlikely to replace them entirely. AI can be used to analyze large amounts of medical data, such as electronic health records, to help with diagnosis, treatment planning, and drug discovery. AI can also be used to assist in image analysis, such as in radiology, to help with the detection of certain conditions. However, there are many tasks that AI is not currently capable of doing, and that doctors are uniquely qualified to perform. For example, AI systems lack the ability to truly understand and empathize with patients and their emotions, which is an important part of the doctor-patient relationship. Additionally, AI systems lack the ability to make subjective judgments and ethical decisions that doctors often need to make in complex medical cases. It's important to note that AI can be a valuable tool for doctors, but it is not a replacement for the human touch. AI can assist doctors in many ways, but it cannot replace the knowledge, experience and compassion of a doctor. Instead, it will augment the abilities of a doctor, making them more efficient and effective in their work.